Thank you, Senator. It's Dr. Cliff Porter. I'm the Senior Fellow for Healthcare at the Texas Public Policy Foundation, representing that organization. I'm also a private physician locally and representing myself. So, strong supporter of SB 1318 to reduce the anti-competitive, anti-choice conditions and just dovetail and everything Senator Schwertner said. These practices really do badly restrict the opportunities for physicians and other ancillary healthcare professionals. And what they often have to do is sign these non-compete looking for those positions. They're essentially stuck into it. And I thought about using the term indentured servitude, but that's quite right. It really is in many different ways. In a larger market, there can be more options. And so with these geographic restrictions, quite often some people are forced to move significantly if they want to get out of those non-compete or pay a significant amount of money. The problem it has in the rural areas is that people are sort of disincentivized to even sign up for a non-compete in these more rural markets, and so they don't even want to go. And that actually is another way that keeps people out of those markets, because you just have a few big players, whether it's a large insurance or a large hospital system. These corporatization is squeezing them out. I had my own case. I signed a non-compete with HCA, Care Now Urgent Care locally, with 3-year contract and a bonus. After I'd only been there about 6 months, and I had my military training. I was active duty, stayed in Austin, switched to the National Guard, and said I couldn't go to my military training, I couldn't cover my shifts. And I said, well, you can't do that. Now I had enough experience and stuff to know that they couldn't do that, and I could resist that, and some clever military terms I won't share. But I said no and just set up my own practice eventually. But they had the overconfidence that they thought with that non-compete, they could just buffalo me into not doing my military training. So I left and moved on. I have a non-insurance clinic now, completely out of non-competes. But several friends of mine, particularly in specialists as well, I'm primary and urgent care, so I can do quite a bit myself outside. But specialists, they have a significant problem. They'll have to move. One guy had to move from Beaumont to Dallas to get out of a non-compete. So with that question, Senator.